This is chapter 47 in your Modern Dental Assisting book, Laboratory Materials and Procedures. So in this chapter, we're going to speak a little bit on the dental laboratory. Uses in the dental laboratory are going to include making models from our preliminary impressions, trimming and finishing our diagnostic models, preparing custom trays, and then polishing our provisional coverage, partials or full dentures, and our indirect restorations. Safety in the dental laboratory, we have physical safety, no fire escape routes, and location of fire extinguishers. For chemical safety, we're going to take a look at our materials because they may be corrosive, toxic, or carcinogenic. Biohazards includes the treatment area, sterilization center, and any other items that might harbor blood or saliva. In our laboratory rules, we're going to follow infection control and OSHA rules. Laboratory equipment is going to include our heat sources, so we're always going to want to turn them completely on and off to prevent gas leaks. Our model trimmer should be used to trim stone or plaster models. This is going to work most efficiently when it's kept clean to prevent buildup on the trimmer. Vacuum former is used to construct custom trays for bleaching, mouth guards, surgical templates, and positioners. The dental vibrator is used to remove air from mix of plaster or stone. This will aid in the flow of material when we're pouring up our diagnostic models. We also have our laboratory handpiece. They're used for various tasks, including trimming, adjusting, and polishing outside of the oral cavity. The sandblaster is going to spray sand and create a etching or pitting effect. Articulator would be used to hold our models in position to replicate the bite. Facebow is going to determine the positional relationship of the maxillary to the TMJ. The TMJ. The dental lathe is used to trim and polish custom trays, provisional coverage, dentures, and then also indirect restorations. And then we all have various supply of spatulas and bowls. Dental models are a three-dimensional reproduction of the teeth and the surrounding soft tissues of the patient's maxillary and mandibular arches. We also might refer to these as study casts. We would use these for diagnosis of a fixed or removable prosthodontic device, diagnosis for or of ortho treatment. We also like to use these as a visual for dental treatment, production of custom trays, creation of orthodontic appliances, making of provisional coverage, and then also to make mouth guards for our patients. Gypsum products are chemical properties. They are minerals, so they're mined from earth, unrefined, dehydrated form of calcium sulfate. Heat converts into a powdered hemihydrate. Setting reactions, so nuclei of crystallization, and then we have our plaster type 1 and model plaster type 2. Dental stone, this is going to be our type 3. Dye stone is our type 4, and our high strength stone is our type 5. The model is going to consist of two parts. We have our anatomic portion, which is created from the alginate impression, and then we have the art portion, or more like the base of the cast. There are three different pouring methods that can be used to create the base or the art portion. We have the double pour method, the box and pour, or the inverted pour method. Trimming and finishing models to a geometric standard gives a very professional appearance. And then the wax bite registration will be used to articulate when we're trimming. Digital models give an excellent presentation tool to help patients visualize and understand treatment plans. Advantages include little physical space to store. These are easily accessible, they're easily duplicated, they can't be misplaced, and then they're also unbreakable.